Hello everyone, my name is Luiza Dobre. I'm the CEO and founder of Komed Health, and a young company based in Zurich, Switzerland. At Komed Health, we are dedicated to transform healthcare communication in hospitals by helping doctors, nurses, and other healthcare professionals to actually provide the best-in-class patient care and ultimately save lives. Basically, we are providing a communication platform similar to Slack for the ones who know it, but it's purposely built for hospitals. It's secured and it's integrated in the IT infrastructure of the hospital, improving substantially collaboration and communication between healthcare providers. But I would like to shock you with some numbers before I actually go to the actual solution. Every 6 seconds, somebody dies because of communication inefficiencies. In the US, there are more than 250,000 people dying for this reason. And maybe you wonder why, because communication, it's so easy for all of us. Well, in hospital, communication is really in the Stone Age. There are many outdated legacy systems that they don't interact with each other. There are disjointed communication solutions, like pager, fax, DEC phone, and WhatsApp, which is unsecure. A nurse spends only 20% of her time with the patient. So basically, at Komed Health, we are bringing digitalization in hospitals by providing a secure and powerful communication solutions to actually improve communication and collaboration. We have designed our platform bottom up with the doctors. We spend tremendous amount of time in hospitals to really understand their workflows in order to accelerate them. Through the integration in the electronic medical record, we are able to push the right information to the right person at the right moment in time on their device of choice. Our application is embedded on the iOS, Android, and desktop. At the moment, we have more than 400 active users in Switzerland. We have done several pilots, 2 of them converted in a rollout in the biggest hospital in Switzerland. We are talking about 10,000 users. They actually, because of our use case, they decided to actually prioritize interoperability and build a middleware where our application will be the first one hanging on that. We also have a very strong pipeline. More than 33 hospitals showed interest to pilot or roll out our solution in the next month. How we do that? Yeah, it's not very scalable model, also my colleague has mentioned before, but in the first year and a half, the same as my previous colleague that was talking before, we focus on really building the process A to Z. And afterwards focusing on building the scalability to partners like Deutsche Telekom or DI Engineers. For example, DI Engineers are a data integrator for more than 200 hospitals in Germany and Switzerland, and by connecting to one single API, we have access theoretically to the entire data from all these 200 hospitals. So this is our model to scale. We have a typical SaaS model, user per month, and depending on the modules that they are interested. Also, we have volume discount and integration and actually implementation costs. In terms of competition, we have competitors in US, and some of them are also starting to come in Europe because really now it's a time for communication in Europe. And our aim is to actually put the standards in digitalization in hospital in Europe. What I'm most proud of is my team. We have a team that is really committed to actually bring this in hospitals, engineers, business people, and people coming from the healthcare field. In order to actually fulfill the customer request, we are raising now 1.5 million. We have done a seed round 1.5 years ago, and by end of Q3, we are aiming to raise this 1.5 million to actually bring our technology in hospital and continue the rollout. So I would like to thank you very much and invite you for questions. Everything clear? Then it was an awesome pitch. So the hospital, gentlemen.
Yes, so we all know Slack. And we know the benefits and disadvantages. We know the challenges that people have in adopting Slack and then the bigger organization. So how does your product really differentiate from from a normal communication application?
So the first thing is we are highly secure. Slack is not, it's built on it's not secure. The second one, we are integrated with the interfaces of the hospital. So basically, when a patient comes to the emergency room, a chat room in our system is created for this specific patient automatically, and the relevant person, the person on call, is invited to the chat. And basically then the whole process goes in the context of that specific patient. Also, an emergency physician, instead of calling or trying to find out when the lab results are there, he is able to get a push notification when that information is in the system. And this is like transmitted directly from the EMR. So these are the two biggest important. And then also it's very simple. It's actually designed with clinicians in terms of UX. And in order to like really accelerate the workflows, we really focus on process acceleration to the way we design the application. Does this answer your question?
Yes, because communication is always an issue with doctors, correct?
Of course, they use pagers.
Yes.
Yeah, but they use pagers. They don't have the right tools to communicate.
I think you're working with 4 hospitals in Switzerland.
Yes.
How are you going to go to work in other countries? What is your commercial strategy? And which are the next countries you are going to enter?
So at the moment, in the next 1.5 years, we really focus on doing this hospital A to Z, one hospital, second hospital, and we really optimize the processes in order to be able to define partner programs to actually outsource some of these processes in order to do that. At the moment, we are already in discussion with several hospitals in Germany, including Charité or Sana, and the same in UK. We are focusing on specific strategic projects in this market for next year, but afterwards, by having the learnings from our full rollout, this is how we plan to go in these countries with I call it a SWAT team, and then do the same 3 to 5 hospitals and then scale it out through partners. And then you go to the next country and then you scale it out through partners.
The idea is to sell directly to the hospitals?
So part of the sales will be directly to the hospitals because you need to be in the hospital. You really need to prove efficiency measures. Like Michael has said, it's everything about cost. And our solution is proof that secure messaging can save actually tremendous amount of cost. For example, for a hospital like Inselspital can save up to 65 million if it's implemented correctly. And this is what we need to prove that we can actually deliver that. So we will do part of the work, and then the more we grow, the more we actually do it also through partners. It will be a combination. Yes, Ben, please.
Yeah, in terms of multimedia, what can you integrate and what can't you integrate in like consultation of images, and where does the system stops?
So the system doesn't stop anywhere because we have all the HL7 fire infrastructure. We are built on the latest technology possible. We have a very easy to integrate system. The sky is the limit. I mean, we could theoretically integrate with 700 protocols that exist in integration, but is this needed? No. And we realized that 5 business cases like employee directory, patient demographics, lab result, radiology, and potentially scheduling, these are the most important that has to be integrated. And potentially where pager are transitioned out because we eliminate the pagers, can be integrated into the pager call. But you do not want to be integrated with every protocol, because then it becomes also too heavy also for physicians and nurses.
Okay, we'll take one.
Just once you close the contract with the hospital, then how do you train the doctors to use the solution?
This is part of the implementation part. So this is what we are doing now. We do a workflow analysis, and then we go there and actually we call them customer success managers. That's why we also raise money now. We will have 2 customer success managers to really make sure that the users feel, we basically need to engage them and make sure that the application is rolled out correctly. Because what we have seen, if you give them just a tool, they will sometimes, doesn't matter how easy it is, you need to actually, it's part of change management. You change one tool to replace it with another one. And you have the innovators who will do it, but you'll have the laggers who still need to be part of the process because it becomes a single point of communication, taking everything else.
Thank you so much.
Thank you.